Okay, we will go ahead and get started. Hi, everyone. My name is Elizabeth Everett. I'm the Deputy Director at First 5 Nebraska. We are very fortunate to have you here today to discuss legislation in Nebraska legislature. So I will hand it over to Diego, who will give our language justice statement.
All right, thank you so much. Hi, everyone. Hope you can hear me. I'll give the instructions briefly in English first and then go into Spanish. Así que doy las instrucciones en inglés y luego las repito en español. I'm Diego Pons here with the CLC. Like Elizabeth mentioned, we'll start interpretation here momentarily. Once interpretation is activated, you'll see that globe icon that says interpretation that will appear in the bottom right-hand corner of your computer screen. That globe icon will say interpretation. You select it and you choose your preferred language. And if you're joining the meeting today on your cell phone or tablet, please look for the more button or the three dots button to select your preferred language this other way. As always, if you're not fully bilingual, I strongly encourage you to select your preferred language so that you can listen to the interpretation in case anyone speaks in the opposite language and you would like to know what they're saying. If you're bilingual, you can just feel free to listen to everyone in their original language, and you don't need to select the language channel if you're bilingual. That way you don't have to manually focus on switching back and forth manually whenever you want to speak a different language. As always, please pay attention to the speed in which you're speaking. Spanish is about 20% longer than English, but as long as you're speaking at a conversational pace like this, you're going at a great speed for me. And just please make sure you don't pick up your reading speed. That's all. Thank you so much. Buenas tardes a todos y a todas. Yo soy Diego Pons aquí con el CLC. En un momento se va a activar la interpretación. Cuando se active la interpretación, usted va a poder ver ese icono globo de la Tierra que dirá interpretación ahí abajo en la derecha de su pantalla. Usted va a elegir ese icono globo de la Tierra y va a seleccionar su idioma preferido. Y si hoy está asistiendo a la reunión en su celular o en su tableta, busque por favor la opción que dice More, M-O-R-E, que quiere decir más opciones en inglés, o el botón de 3 puntos para que pueda elegir su idioma preferido de esta otra manera. Si usted no es completamente bilingüe, le aconsejo que elija su idioma preferido para que pueda utilizar la interpretación cuando alguien está hablando en el otro idioma. Y si usted sí es bilingüe, se puede sentir libre de escuchar a todos hoy en su idioma original. Muchas gracias.
Ok, gracias.
Okay, so the interpretation has started. If you go ahead and click your preferred language, that would be great. All right, I'm going to go ahead and share my screen so we can go through the presentation for today. So again, hi everyone, my name is Elizabeth Everett. I am the Deputy Director at First 5 Nebraska. We are a statewide early childhood policy organization focused on supporting policies that provide quality early care and learning opportunities for our state's youngest children. I am joined today by several of my colleagues to provide you an update on legislation that's happening this session. So I'm joined by Sarah Howard, a policy advisor, Mitchell Clark, a policy advisor, Michael Medwick, who does strategic communications for the organization, and then Jody Renee-Jerome, who's grassroots advocacy advisor. So as always, just a few reminders about how this presentation will flow. For the bills that have updates, they will be in black, and we will discuss those specific bills. For bills that are highlighted in gray, it means that there has been no update from the previous policy call, so we will not be spending time discussing those. If you do have questions about the status of those bills, you can always go onto our website. It does list our legislative watch page that shows all the bills and their current status. It also does provide a recording in the PowerPoint for the previous policy call. So if you want to, you can defer back to that policy call to learn more about that specific bill. Several things are happening in March. So I'll go through a couple of deadlines that I've spoken about in the past. So we do have the deadline at on the 13th, which is Thursday, for a speaker priority designation. So this is when senators request the speaker to prioritize one of their bills for them. Speakers get 25 bills to prioritize. So for some senators, they do look towards the speaker to do that for more of their bills. We have the deadline for both senator and committee priority designations at the end of this week for Friday. So each senator gets 1 priority designation and each committee gets 2 priority designations. We have our next policy call on March 25th. Again, just a reminder, these policy calls will only be happening in the afternoon at 1:30 p.m. We have the final date for public hearings, which is March 28th, and then the first day of full day floor debate beginning on March 31st. So really the month of March is wrapping up hearings, getting those bills prioritized, especially during this tough fiscal environment. Bills that are not prioritized will have a hard time getting passed because of limited time for debate and also because of the limited funding that's available. And then also, again, this is the beginning, at the end of the month, will be the beginning of the full day floor debates, where senators will spend time every single day while they're in session, discussing the bills and hopefully advancing as many as possible and get them to the governor's desk for approval. So normally my colleague Katie Bass gives the presentation on child care subsidy bills, but since she is gone, I will go through and provide updates on them. So LB 13 was a bill that was introduced by Senator Michaela Cavanaugh. It would require the state to pay child care subsidy reimbursements based on enrollment instead of attendance. There has been, again, like I've mentioned before, new federal rule changes that is requiring the state to implement these by a certain time period. We were originally supposed to be in compliance already, but because we did submit and were accepted for a waiver, our state does not have to be in compliance until October 2026. But what this specific bill does is that it would put it in statute so that, one, in case the federal government decides to rescind those rule changes, our state would be required to move forward with them no matter what. 2, it would also require the state to identify a funding source to fund the specific change. And then 3, originally this bill was hopefully going to start these changes sooner, but an amendment that was adopted would require these changes to not happen until October 2026. So for us, this would be a safeguard if it is passed into law, because again, it would require the state to move forward with the changes, even if the federal government decides not to. This bill did advance the first round of debate on March 5th with a very slim vote margin. So in order to move past the first round of debate, you have to have 25 votes in favor of the bill, and that's what this bill did receive. So it will be a tough bill to get passed, but we will see what Select File brings us. The second bill I'll discuss is LB 304. This specific bill would make permanent the current income eligibility limits for child care subsidy at 185% of the federal poverty level. This specific bill, if it's not passed either this session or next session, right, those income eligibility limits will revert back to what they were previously and potentially impact several families that are currently eligible for the child care subsidy. Right now, if nothing is passed again this session or next session, by 2026, by the fall of 2026, we would again revert back to 130% of the federal poverty level. For us, that's not an option. We hope it's not an option, right? Because that would put Nebraska pretty low when it comes to the accessibility of child care subsidy. We are hoping that we will be able to pass this bill either this session or next session. The concern will be, again, the fiscal impact that this bill has. Right now, it is an expensive bill, and anything, again, that has a fiscal impact is going to have a hard time getting passed. Our hope is that we'll have a better understanding once the budget discussion is done with. But until that point, most bills with a large fiscal note will not be moving forward. We are still working to try to find a priority designation for this bill and to help senators understand why this is so important. Because again, if this is not made permanent, those income eligibility limits, several families that are currently receiving child care subsidy will no longer be able to. The next bill, LB 339, that I'll discuss, also has to do with child care subsidy, but specifically it was introduced because of a application requirement to receive the school readiness tax credit. So child care employees that wanted to receive the non-refundable tax credit were having to fill out and print off multiple forms in order to get all the data they need to fill out a form required by the Department of Revenue. It was a very time-consuming process, and it left room for several errors. So we introduced this bill to hopefully, one, streamline the process and require the Department of Health and Human Services to provide an end-of-year summary to each licensed child care provider so they would understand exactly what they would need to put into the form that's required by the Department of Revenue. Fortunately, we have found out that the Department of Health and Human Services has signaled to Senator Hallstrom that they can move forward with this change administratively. So there is no need for legislation at this point. So fortunately, we will be able to make this change, and this change will happen by the beginning of next year. So for those of you that did fill out the non-refundable tax credit of the school readiness tax credit form and found it to be very tiresome and cumbersome, please know that changes are coming to streamline the process. LB 442 is a bill that has its hearing on Friday. It was introduced by Senator Spivey. It does create a new child care subsidy system for the state. It would increase the income eligibility limit for child care subsidy up to 400% of federal poverty level, and it would do so by implementing a payroll tax. So there would be a pay for in this specific bill. We did submit a letter in support and are hopeful that we will be able to continue to work with Senator Spivey and the chambers to introduce or pass something like this in the future if it does not move forward this session. We do truly believe that to have the biggest impact, we need to increase the income eligibility limit for child care subsidies so that more families can access this important system. But also, again, going back to the fact that during this session, there are some tough fiscal concerns. So we know that even though this has a pay for, there might not be an opportunity to discuss this bill because other bills will be prioritized. And the system right now might not be fully ready to revamp itself and create a whole new child care subsidy system. I'll hand it over to my colleague Mitch to discuss the next set of bills.
Thank you, Elizabeth. LB 51 would adopt the National Crime Prevention and Privacy Compact, making the background check process more efficient, specifically the federal fingerprint-based segment of the process. Last update, the bill had been passed and was awaiting signature. It has now been signed by the governor and thus is signed into law. LB 248 is a bill that would exempt child care programs licensed by the Department of Defense and on base with military installations. This bill advanced from general file on March 10th. These programs that are licensed by the Department of Defense already have other licensing requirements under the United States military. Next slide, please. LB 157 is a bill that would adopt the Child Tax Credit Act. And so this would make parents eligible for the tax credit for eligible dependents that are under age 6. It would provide a tax credit of $1,000 per child with other step down amounts based on their household income. And that is designed to ensure that those families who most need it are able to receive refundable credits for their dependents under 6 years old. The committee has scheduled the hearing for March 19th, and this is something that First 5 Nebraska will be supporting. LB 182 was a bill that fixed provisions under the Child Care Tax Credit Act. So the original legislation passed in 2023, which created the tax credits, including school readiness tax credits, childcare tax credits, and the contribution tax credits. What I'll be speaking to specifically is the contribution tax credits. Did not contemplate that there are other entities which are interested in donating and contributing to childcare programs to help build up capacity in their communities. This bill will now allow banks and insurance companies to utilize those tax credits and also contribute to childcare in their communities, since they have a different form of taxation. It was also signed into law by the governor. Next slide, please. So a couple of weeks ago, we testified at the budget hearing for the Department of Education. The Department of Education, for the first time, included in its budget request funding for the Early Childhood Integrated Data System. We know that this is important for measuring outcomes, which is especially relevant for policymakers, that we can see the effectiveness of the policies we are passing to support children and families. Ultimately, it was not included in the governor's budget recommendations, but we did encourage the Appropriations Committee to include this in their recommendations to the legislature. The Appropriations Committee still has a few weeks yet of wrapping up hearings for its budget items. And so we will know more in the coming weeks whether this will also be included in the Appropriation Committee's budget recommendations. Next slide, please. And I will pass it over to my colleague, Sarah.
Sarah, we cannot hear you. While Sarah works to try to get her mic to function, a couple of things I did want to note on the Department of Education budget request around eKids. One of the things that we noticed, especially during early conversations on the floor, was that there is a specific interest on shared data systems and how important it is for a robust data system to exist to not only collect information, but to show outcomes. eKids would be something that would be able to be shared by both departments of education and health and human services, would be able to, again, get that specific information we need on outcomes for children, and be able to show just how much a quality early childhood system does go to support both children and working parents. We have tried to work on, specifically eKids has been around for several years. And we have tried to get something like this moving forward behind the scenes. Fortunately, we have been able to make some inroads, but again, based on fiscal constraints and general concerns around privacy, we haven't been able to get agreement by both departments yet, but our hope is that we'll be able to do something like that soon. Let's see if Sarah can.
Okay, can you hear me now?
Yes, go ahead, Sarah.
I don't know what happened. Technology. Okay. All right. Good afternoon, everybody. I'm Sarah Howard. I'm a policy advisor at First 5 Nebraska. I focus on the area of maternal and infant health policy. And today I'm going to start by giving you some updates on our work around home visiting services. Home visiting is services for the prenatal to 3 population, where families are partnered with a trained home visitor who visits them in their home or wherever it's convenient for them. This year we had 2 bills related to home visiting that were pending in the legislature, and they both moved this morning, which is really exciting. The first bill is LB 22. That's Senator Duncan's bill to require Medicaid to bill for evidence-based nurse home visiting. So nurse home visiting is offered to mothers at discharge from labor and delivery. They get 3 to 4 visits in the home with their newborn. And it moved from select file to final reading just this morning, which is really exciting. Within LB 22, we also included LB 104, which is Senator Raybould's bill to define home visiting in statute and to call for an annual report. And the report would be for the years 2026 through 2028. And it was included in an amendment onto LB 22. And so both of these bills are now together in one bill, and they are both on final reading, which is really exciting. Okay, next slide. A few other maternal and child health bills have had some movement. LB 41, which is about prenatal screenings for syphilis, because the rate of congenital syphilis or babies being born with syphilis has gone up quite a bit in the state of Nebraska. And so that was placed on final reading just last week. So it's very, very close to being passed into law. That bill updates our screening protocols for syphilis for pregnant women from one screen in the first trimester to 2 additional screens, one in the 3rd trimester and one at delivery. LB 153 is a bill that allows requires DHHS to file a state plan amendment for postpartum coverage for mothers who receive their prenatal care through the Children's Health Insurance Program or the CHIP program. Sometimes these mothers are called CHIP 599 moms. These mothers are often undocumented, or they are mothers who are minors whose parents' income make them ineligible for Medicaid, but they lose their coverage the moment that they give birth, and they have no postpartum coverage from there. And so LB 153, with Senator Gareca as the sponsor, proposes to put in a state plan amendment to offer these mothers at least 6 months of postpartum coverage. And that has a hearing on Friday, which is really exciting. The last maternal and child health bill that we're very focused on is LB 446. This bill is related to the release of health data for the maternal and child health population. And it had a hearing last week. 2 weeks ago. 2 weeks ago. It had a hearing 2 weeks ago that went really well. And so we're hopeful that that bill will move forward and we would be able to access additional maternal and child health data. Okay, and then my last slide, it just has 2 bill updates for maternal and child health. On March 17th, the Business and Labor Committee had a hearing to adopt the Paid Family and Medical Leave Insurance Act. This would guarantee Nebraska families, particularly Nebraska mothers, paid family and medical leave. That'll be next week. And then LB 283 requires DHHS to implement express lane eligibility. And this is if a family applies for the SNAP, the Supplemental Nutrition Assistance Program, their information could be shared over to the Medicaid program and vice versa, so that you only have to fill out 1 application instead of 2. And that bill will have a hearing in the HHS committee on March 13th. And I will pass it on to, who am I passing it on to? Elizabeth.
Yep. All right, thanks, Sarah. So that's the end of the kind of quick update on bills. As you can probably see, what happens at this point of session is that sometimes there's not going to be many updates on bills, just based on the speed at which the bills are discussed on the floor. There are several contentious bills that have taken up a lot of time. And then also just based on prioritization, right? If bills are prioritized, they will most likely get scheduled. If they have no fiscal notes, they will most likely get scheduled. But if there is a large fiscal impact, it is unlikely that bill will get scheduled or move forward unless there's a pay for. What we'd like to do right now, considering that we've been doing these policy calls now for about 2 months, is ask folks to take a quick survey. We did send out this survey in an email, so that if you registered, you should have received this already. But if you have not filled it out, we would really appreciate feedback. One, we want to know if this is what you would like to see, if there are changes to these calls, if you want different updates, if you want a different style of policy call. So maybe it's not report out, but more of a dialogue. We would really love feedback. So if you could just take a moment, I'll keep this up here for just a few minutes and take the survey right now. We would really appreciate it. Okay. This PowerPoint slide, again, will be on our website so that you can go back in and take the survey if you don't have time now. Or look in your email and take the survey that way. But again, we would really appreciate your feedback on how to improve these calls. So last, I will hand it over to JR to talk a little bit about our advocacy efforts, and then we will open it up to questions.
Yeah, thank you. Welcome, everybody. I wanted to make sure that you could see the advocacy interest form that I just dropped into the chat, but I want to invite all of you to participate in some very intentional work we're going to be doing both this session and then going into the summer in the interim. One of the things I would encourage you to do is as we get together, we're learning that the senators maybe need some more education on childcare issues and the impact on the community. So we're trying to organize and get everybody together and make sure that we have the right information and some credible data in order to make an impact. So we would love it if you would join us in those endeavors. We do know that advocacy is most effective when it's coordinated and credible. And so I'd like to offer you support in that, as would the entire First Five team. So it'd be wonderful if you could join us. You can email me at jjerone first5nebraska.org, or there's an interest form, again, in both English and Spanish that's available in the chat. So please reach out with any questions, or if you'd like to get involved. For those of you that have completed the form in the past, thanks for your patience while we still get everybody brought in and begin to organize. So I appreciate every message I've gotten and have been trying to reach out, but I'm trying to catch up. There's a lot of you and it's very exciting. So please do with questions or ideas. I would love to work with you. And I'm going to pass it back to Elizabeth.
Great. Now we'll open it up for questions. If you have any questions in English or Spanish, please put it in the chat or come off mute.
Hey, Elizabeth, this is Wendy Gwinnett. Can you explain a little bit about LB 13, the floor debate? There were 3 different amendments. One of my senators voted yes for one of the amendments, but ultimately voted no for the bill. Could you give me a little bit of insight so I can talk to my senators about why that happened and why were there so many amendments and all those things, please?
Yeah, and I'm actually probably going to ask my colleague Mitch Clark to also help in. So there were a couple of amendments that were introduced on LB 13. The bill itself, right, went up for debate on general file. Normally on general file, you can file amendments either, right, amendments might come out, a committee might file an amendment on the floor, or a specific senator might file an amendment on the floor. There were a couple of amendments that were either adopted or withdrawn. Wendy, who is your senator?
I work with Senator Merman in my home county, and where I work is Senator Lewinsky.
Okay, so the Health and Human Services Committee, as part of kind of their agreement moving forward with the bill out of committee, was that they were going to introduce an amendment that basically pushed back the date to July 1st, 2026. That was one of the requests, one of the reasons why the Department of Health and Human Services came in opposed to the bill originally, was because they assumed that this was, again, doing something that we didn't need right now, when the final rule that came down from the federal government required us to come into compliance by that date. So they agreed on this amendment. This was something that Senator Kavanaugh agreed to, so this specific amendment was adopted on the floor. I do know that Senator Kavanaugh also introduced an amendment that she withdrew. Again, saying the same language, but she basically went ahead and just withdrew it because it was already adopted in a different amendment. So there was that one. And then I do know there was also another amendment by Senator Kavanaugh that just changed the language from July to August. So I will have to look to see which one Senator Merman voted against, but the amendments that were adopted were just clerical and technical amendments that just fixed things. There weren't specific amendments that moved forward or that had any that weren't like a messaging amendment or something that was making a substantial change to the bill. I don't know, Mitch, if you could look up really quickly which one Senator Merman voted against.
It was Dan Lewinsky that voted, and he voted yes on Amendment 249. So I wasn't quite sure why, what would cause that to happen and how I can use that as a talking point going forward of like, if you're yes to this, how do we say yes to more? So if it was just the date change, I mean, I understand that there's probably not a whole lot to do there, but.
So it does look like the vote that Senator Merman and Senator Leneski voted no on was actually final advancement of the
Right.
bill. There was a lot of discussion on the floor about, of course, the fiscal situation, but also kind of some what if scenarios on what the feds may or may not do. And so there was hesitation among some of the members to move forward with this at this time, given the uncertainty at the federal level.
Thank you.
And so, yeah.
Yeah, but sometimes, I mean, truthfully, Wendy, right? Sometimes sometimes similar amendments are introduced on the floor. So depending on, again, which one the introducer requests or the committee, like the chair requests that you vote on, they will vote on that specific amendment and they'll say vote no on this one because it was a mistake that we introduced it, or maybe, hey, we actually introduced another amendment that cleans up this language, or this is the correct amendment that we want you to we want you to vote on and move forward. The ones that, again, on 13, they were all around the date. So my understanding would be that it was just a simple, they probably just didn't have their ducks in a row a bit around which ones they wanted to introduce it and get moving. So the committee amendment did move forward, which was the important part.
And the other thing I will say too is that sometimes just in monitoring the votes, you may have some that have a philosophical disagreement, and I'm not making any statement on Senator Merman or Leneski in this case, but you may have some who have a philosophical disagreement, so they may vote no all along the way, whereas you may have others who maybe vote no on a certain amendment or maybe final passage of it, but they'll vote for an amendment because it's making a change in a direction they would like. So if you would like some more discussion over this, reach out to JR and we'd be happy to connect and kind of get some more information gathering for you as you reach out to your senators.
Yeah, but I would probably say, Wendy, that this is probably one where I wouldn't look too much into it. I don't know if there's any nefariousness behind it, right? It was just probably not voting on one amendment over another one that did the exact same thing.
I just got excited. He voted yes for one piece of it. So I'm like, how do we prop that door open? Let's kick that door down a little bit and let's have the discussion. So thank you guys. I really appreciate your explanation.
Other questions? All right, well, if that's it, thanks again for joining us today. As a reminder, again, March 25th will be our next policy call at 1:30 p.m. Thank you.